Plastic surgery really occupies this unique dual space in the surgical world because we're both creators and restorers. And in that sense, plastic surgery is kind of like architecture, if you may. Whether you're reconstructing a face, or you're salvaging a limb, or you're just doing a nose job, the imperative is the same, creating form without betraying function. So my service covers the full spectrum of plastic surgery, and that includes both reconstructive and aesthetic surgery. On the reconstructive side, these are usually procedures that are related to a deformity or a defect that can be the result of another surgery or a result of cancer treatment or trauma. And these essentially are functional procedures that also carry an aesthetic outcome. On the other hand, there's the aesthetic portion of the service, which is related to the full spectrum of aesthetic surgery, from facial rejuvenation, breast surgery, and body contouring. And in essence, these are procedures that are done for aesthetic enhancement to restore confidence in the most natural way possible. And there's also some specialized service that I'm planning to also introduce, including things like migraine surgery, lymphatic procedures on selected patients, as well as nerve reconstruction. A typical first visit with a patient mainly include getting to know the patient, getting to know their concerns and what they're really trying to achieve. That is typically followed by my objective assessment, which includes sometimes clinical photography, photo analysis, and even occasionally virtual simulation. After we get all this information, we have a deep dive into what surgical or non-surgical options that this particular patient may have, along with the realistic expectations. And my goal on the first visit, and even every visit with any patient, is that they are leaving well-informed, comfortable, and confident with the decision that they're about to make. The most rewarding part for me is seeing the patient make the shift, and not just physically, but in how they carry themselves. Whether you're doing a procedure that helps patients recover from cancer, or a procedure that helps patients deal with a deformity that they lived with for so many years, there's always this very particular moment when they feel like themselves again. The first part is the extraordinary care, the promise of providing the state-of-the-art medical care, but also, and very specific to plastic surgery, it's giving options. And that's the reason I say specific, because in plastic surgery, there's rarely one solution to any single problem. So that becomes very important. And the other part is everyday, which implies consistency, and that's also very important. And again, to plastic surgery, that means that every problem, no matter how big or small, should receive the exact same amount of attention. And I think my personal goal from my service within McFarland Clinic is that nobody should be looking elsewhere for services. They should be able to find any kind of plastic-related problem solution within our system.